Hello friends, my name is Dr. Sundeep Mishra. I am Professor of Cardiology at AIIMS New Delhi. As we approach the World Heart Day, I would like you to know that heart failure is one of the commonest conditions affecting our country, and about 1 crore of heart failure patients are present at the moment in our country. Not only that, it is one of the most common causes of mortality in the country, which approaches that of cancer. And 1 out of 3 people suffering from heart failure in India die within 1 year. Not only death, but recurrent hospitalization is another important problem with this condition. So what is heart failure? As you might know, heart is a pump whose function is to pump blood all over the body. Heart is made predominantly of muscles, the heart muscles, which do this pumping work. When these heart muscles become weak or stiff, then they cannot pump enough blood all over the body, and then there is deficiency of or decrease in oxygen supply to the body. So what are the symptoms of heart failure? Breathlessness or inability to take breath is one of the most common symptoms and most important symptoms of heart failure, especially when one is lying down, which means that once person lies down for some time, he starts feeling breathless and he has to sit up. Besides breathlessness, the other symptoms are swelling over the leg and abdomen, and irregular heartbeat, excessive tiredness or fatigue, decrease in appetite, and frequent passing of urine or frequent micturition. These are some of the important symptoms of heart failure. Now you would want to know what is the cause of heart failure. You have to understand that heart failure is not caused by one disease, but it can be a mixture of many diseases and can be end result of some very common diseases. For example, high blood pressure or coronary artery disease, angina disease, or even heart attack can very frequently cause heart failure. Besides that, diseases of the heart muscle, valvular diseases, and many other diseases can cause heart failure. So you would want to know what is the treatment. Of course, a lot of medicines are prescribed by the doctors, which I think you have to take. But besides that, what you can do yourself is to restrict fluid, to eat a proper healthy diet, to restrict salt in your diet, to do moderate exercise, appropriate exercise, and also to avoid alcohol and smoking. Finally, as we enter the end of the lockdown period for COVID and we are now in the stage 4, many people are afraid of going to hospitals because they are advised social isolation and they fear getting COVID infection when they go to the hospital. But for heart failure patients, it's important that even if they don't go to hospital, they should keep in contact with their doctors and take proper medicines, and as soon as there is some worsening of symptoms, they should definitely contact and get in touch with their doctors and get admitted if required. Thank you.